So I'm Cheryl. As I said, I'm a nurse practitioner from the Ottawa Hospital, and welcome. This webinar is intended to increase your knowledge about how to access eConsult, how it can improve patient care, what type of specialists are available. And the idea arose when Kelly was wondering how many nurse practitioners in long-term care and community knew about eConsult, how many used it, and how many had access to it. And currently I'm working with a team of 4 NPs, and we all access the eConsult system for residents in long-term care in the Ottawa area. And as you know, access to specialists can be very challenging, particularly for those who have cognitive impairments or physical disabilities, financial restraints, inadequate social support, or combinations of these. So additional wait lists for specialists are often very long. eConsult facilitated access to patients and residents for many different specialists across the region and now across Ontario, who otherwise would have to wait months to be assessed. So additionally, if an alternate specialist can be identified as opposed to the one you've actually contacted, that will actually be identified as well. Other benefits include knowledge translation. I've learned a lot from the specialists. Identification of other appropriate tests or procedures or treatments that can be initiated by us or by a physician if needed, rather than having to wait for the face-to-face consultation with a specialist. And the NPs that I've contacted or heard from love the eConsult. They like the results that are produced, enhanced care, and reduced wait times. So I'd like to welcome Dr. Erin Keely. She's a professor at the Department of Medicine at the University of Ottawa and an endocrinologist at the Ottawa Hospital. She is co-founder of the Champlain-based eConsult service and specialist lead at the Ontario eConsult Centre of Excellence. Welcome.
Thank you so much, Cheryl. I'm really delighted to be able to speak to you today, and really happy to hear about how eConsult has helped your practice, Cheryl. Okay, for some reason I can't switch the slides over. Oh, there we go. So I'm just going to present a little bit of background about eConsult, and in particular about the Ontario eConsult program, which really has been in effect since June 2018. We'll talk about how you can integrate eConsult into your practice, and then I hope that some may have questions or insight into their own experience. So the problem, as Cheryl mentioned, is about access. So we know that patients are waiting too long to see a specialist, and we know that you as primary care providers send in referrals. And often you don't even know whether the fax was received, whether the patient's been booked. Patients are concerned about the length of time it takes for them to be seen. And as a specialist, I'm actually frustrated that I see patients in a more timely way when patients will come, after waiting 6 to 9 months, and I'm repeating lab tests because the ones to make a decision on are too old to be valid. So it's frustrating all around. So this is a picture of Claire, and I am not the blonde, I'm the other one. She came to my office after referring a patient to endocrinology who was going to wait 9 months, and came up to talk to me about it over a cup of coffee, and we decided that this was silly and that we should do something about it, that it was not okay for patients to be waiting that long, and for primary care providers not to be getting any help while the patient is on that wait list. So that was back in 2009, actually, that we had our copy, and we put in a small grant, a $100,000 grant, and back then we were actually going to do it by email. So there weren't the same privacy concerns, but that was just starting at that time, so instead of going to an email, we went to an eConsult service. And really this is where you as a primary care provider can use a secure electronic dialogue with specialists to manage the care, and you may not need to refer the patient to the specialist. If you do need to still refer the patient to the specialist, then you have some advice to act on while waiting for that face-to-face visit. So it's faster access. It may avoid unnecessary in-person visits, especially for your patients in difficult circumstances. It improves the care coordination, It's more flexible than the phone call, so for urgent consults, by all means, telephone calls, pages are the way to go, but that often is difficult to get us both on the end of the line at the same time. And as already mentioned, it actually has shown to be beneficial for improving relationships between primary care and specialists, that back and forth conversation, that education provided by the specialist, but also the education received by specialists, because the questions are so good that are coming through eConsult, it often prompts us as specialists to go and learn more about the question that's being asked. So how does it work? So on the right-hand side is a page from the Champlain base eConsult service, and I'm going to explain the different services in a minute. But basically, no matter which service you are using, you have a login, so you're provisioned to use the eConsult service. It is secure, meeting all the privacy requirements. And in our system, you'll see on the right-hand side that you actually select a specialty group as opposed to a specialist. So you'll see palliative care, you'll see ENT, endocrinology. And some of those groups have a different subspecialty group. So here's a listing of all of the pediatrics groups that are available on the Champlain base eConsult service. And then once you've entered the information, and it's a free text box of the question that you want to ask, you can attach documents, you can attach photos with it, you can attach lab results. It then gets assigned to a specialist within that group. So I think there's about 5 endocrinologists, for instance, that are active on the Champlain base service. It gets assigned to one of them, and the expectation is that you get your answer within 7 days. If there needs to be back and forth conversation, so that the specialist can't answer the question without asking you for more information or wants clarification, then there can be back and forth. And then when you're happy with the answer that you received, you close the eConsult, and we actually have a mandatory survey, which I'm going to present some of the results with, which is really driven to show the benefit of eConsult and allowed for a true provincial program. So the BASE model, BASE stands for Building Access to Specialists Through eConsultation, is what Claire and I developed and launched in the Champlain system. As I mentioned, it's a managed service, so rather than individual specialists, you choose a specialty group, which we manage. So we recruit the specialists, provision the specialists, and have some oversight into the responses and the quality and timeliness of the care that they're providing. We are very strategic in who we engage with. We want highly regarded clinicians who are committed to both the response time but also value that communication with you and really want to provide that education to you. Folks who are primarily interested in compensation, that they may not find that this suits their needs. This is not going to be a huge part of anyone's practice. It's really about wanting to provide better access for patients and that support for primary care. We pride ourselves on high-touch engagement, meaning we're quick to respond when there are problems or questions, and we do monitor, maintain, and upgrade as we get feedback. Most of the services that we provide actually came from suggestions from primary care. Oh, could you find me a concussion expert? I have really struggling with looking after patients who have had a concussion, and we will go out and try and recruit that specialty. We started in the Ottawa region and have had a regional focus, but as we get into the Ontario program, you'll see that there is a true provincial model that's available to all of you, and then there are some regional sites which are going to support that community of practice within your region, but all parts of the province have a full access to a full slate of specialty services. As I mentioned, we expect the specialist to respond within 7 days, but in fact the median time is less than 2 days, and this has been steady ever since 2010 when we launched our first service. So the specialists are continuing to answer in a very timely way. They actually enjoy doing them, and it's been rewarding to see that. For your practice, I expect many of you are looking after patients who are living in very complex situations, and we strongly believe and are trying very hard through several projects to provide equitable access regardless of circumstance. With our partners in the Kingston area, we are now providing eConsults to Corrections Canada. Homeless, you actually don't require an OHIP number from the patient to be able to access the eConsult service. Long-term care, which I'll speak to a little bit, geographer, we have a program going with Nunavut who, for patients who require face-to-face referral, they travel to Ottawa, so it was a natural link to link with the Nunavut primary care providers. And Clara has led a big grant in chronic pain and HIV for patients who really are struggling with very complex medical conditions. I love this quote from one of the primary care providers because although it's about improving access, it's also giving access to patients who would never otherwise receive it. So I have patients who are special needs, and the eConsult has dramatically improved the level of care I can provide because many times just getting those clients to an appointment is difficult or they won't cooperate with a new person. So the eConsult has been excellent and allowed the patients to get access to the care they deserve. And I think for those of you working in long-term care, the same would apply for your patients. Getting to a specialist appointment is just not going to be very feasible, so this provides an alternative. In our provincial service, when we launched the new service at the end of June, we specifically wanted to make sure that we included chronic pain, opioids and addiction. We had mental health service psychiatry for both children and adults. Transgender care was requested and is provided, and HIV, just as a few examples. So what about the access in long-term care? Because I know some of you are working within long-term care. And no surprise, the people who require long-term care facilities have lots of chronic medical conditions and a need for specialist care. They face particular challenges in accessing specialist care due to transportation, the need for caregivers to go with them, the frailty, the ability to go out in the winter without slipping, behavioral challenges, the costs associated with travel to specialist appointments. This can lead to delayed diagnosis and often poor care coordination. And certainly being on the receiving end, I must admit the note that's written at the end of the visit is sometimes not as thorough and complete as it could be because you're writing it in real time, and it certainly is not ideal. So there is a project undergoing now to target support for adoption in long-term care homes in Ontario, and this is a key initiative for improving patient care and safety, reducing those unnecessary transfers, and reducing costs, but also burden to the residents, their families, and to the long-term care home. So we've looked at a lot of our results, our utilization, our survey results, focus groups, interviews with patients, providers, and looked at the benefits of eConsult across what's called the quadruple aim. So the quadruple aim of any healthcare improvement should be better population health, improved patient experience at a lower cost, and improved provider experience. And Claire and I have about 60 publications related to the evidence around eConsult, and happy to share its website is champlainbaseeconsult.com, but really have been able to show benefit across the 4 pillars of the quadruple aim. The other big area that we certainly weren't experts in before we started this journey, but have learned a lot, is about policy and implementation issues, both within the province, but also especially when you're looking across provinces and interjurisdictional challenges. And we've been tackling some of these and trying to come up with best practice for some of these. So there is lots and lots of evidence that eConsult works to improve access. Patients are happy with it. They think it's highly valuable. and they have very limited concerns about privacy, which is interesting. They trust us that we will keep their records private. Lower cost, so the average cost per case is between $45 and $50. So the specialist does bill for the consult. They self-report how long it took them to complete the eConsult, and we pay them quarterly based on that. And the average cost per case is about $45 to $50. And as you already heard in the introduction, providers, both primary care providers and specialists, are finding it highly valuable for the collegiality, the communication, and the education. So provider experience, this was interviews we did with primary care providers. They rate the eConsult as very high value. From their comments, we know that the quick response time is really appreciated as opposed to waiting 6 to 9 months to get help. The high quality advice, so in general, the quality of the responses and the teaching pearls within them have been highly valuable. And the educational value, as already mentioned. So this consult not only prevented unnecessary consult for this patient, but also gave me a teaching point to care for my future patients by avoiding unnecessary testing in asymptomatic patients with right bundle branch block. So what about your peers? What about do nurse practitioners say about eConsult? So these are some of the feedback comments that have been left. The answer was timely, thorough, and gave very useful information to guide my next appointment with this patient. Great timely service, saved the client a trip. Dr. X was most helpful in guiding immediate next steps for this patient and provided a great learning experience for me. My plan was to reassure the family that no action is required, and I think the advice will have much more weight since it's backed by a specialist. So building confidence and capacity within primary care, and sometimes very reassuring for the patient when you can show them the transcript. I've spoken to the specialist. They've confirmed that we're on the right track, and that can relieve the anxiety for the patients. And fantastic service and reassuring to the patient. So through the Champlain base service, so this is the service that's available for primary care providers in the Champlain region together with Mississauga-Halton. There were 1,300 patients who received an eConsult that nurse practitioners submitted through our service in 2017. There are approximately 200 nurse practitioners registered, and 128 have submitted at least 3 eConsults in the last 6 months, which is how we define active. And you got your response just under 3 days. The survey questions include what best describes the outcome of the eConsult for your patient. The options there are, I got confirmed my course of action, I got new or additional course of action, or none of the above. And this is a little bit different than the physician-submitted eConsult. So 65% of the time, your colleagues who did an eConsult changed what they were going to do for that patient. 32% of the time, it reassured them, confirmed their course of action. It's about 50-50 for physicians. So it's interesting that for nurse practitioners, it seems to be changing next steps more often. The pie on the right-hand side is, were you going to refer the patient if you didn't have eConsult, and are you still going to refer the patient after you receive eConsult? So the 38% is referral was originally contemplated but now avoided. So 38% of those 1,300 patients would have been on a wait list to see the specialist had eConsult not been available. And that's about the same as we see with physician referrals. The 4%, which is also the same as we see for physician referrals, is that you weren't thinking that you were going to send the patient for a face-to-face visit, but now you are. So something that the specialist replied to you in that eConsult has made you decide that you will have the patient go to a face-to-face visit. And interestingly, in urology, it's 8%. So there's some disconnect or difference about needing to send urology patients for a face-to-face visit, which from a patient safety point of view, we think is huge help in getting those 8% of patients to see the specialist faster. So who do you ask to help you through eConsult? Well, dermatology is number one, and that's the same for everybody. So we have a huge access problem for dermatology, and it's so convenient to be able to take the picture while the rash is still there rather than them seeing the dermatologist 6 months later when the rash is gone. Hematology, endocrinology, OB-GYN, GI are also highly used, but you can see there's a wide selection of specialties that you're reaching out to through eConsult. And we really have, I think there's 114 now specialties on the Champlain-based service, and those are, there's really none that you can't access. So here's a couple of examples that your peers sent. So primary care provider sees a patient with type 2 diabetes. The blood work reveals an abnormal white blood cell count, some other abnormalities. Primary care provider provides the patient's medication history, asks the specialist if the patient requires any further investigation or treatment. You could attach that lab result as a document so that the hematologist could look at the CBC themselves. Hematologist suggests retesting in 3 months. If levels remain high, primary care provider can test for possible myeloproliferative neoplasms, and they would suggest how you can do that. And they accept the advice and closes the case all within a week. What about a dermatology question? The primary care provider asks a question about a patient complaining of a spot on their chin that's lasted 2 weeks. The spot's not itchy or painful and doesn't bleed. Provides the family history, risk factors, attaches that photo, and requests advice. The dermatologist suggests the mark could be an actinic keratosis or an eczematous process, but recommends light cryotherapy to remove it. They emphasize that the patient should use sunscreen daily and avoid unprotected sun exposure. You accept the advice and close the case. Cardiology, a patient with heart failure who's on multiple medications and reports losing the ability to taste food. You provide a complete list of medications to the specialist and ask which one is most likely to cause this as a side effect. They identify 2 of the most likely culprits, and they suggest stopping medication 1 first, as medication 2 is more important for improving outcomes, and wait several weeks to see if there's any improvement. So those are just a few case examples of how it's been used by your colleagues. So all that background work through the Champlain-based service that we started in 2009, at the same time, the Ontario Telemedicine Network, they had a long-running teledermatology service, which they still do, and they embarked on a multi-specialty eConsult service in 2014. So the province initiated this pilot, which was led by Ontario MD, for 3 years to look at the feasibility and models for provincial expansion of eConsult. It was in a staged rollout, so 7 LHINs got access first, then a few more, then a few more. And then in December 2017, right before the Christmas holidays, someone clearly wanted to get this off their desk before they went away. They released a memo to the Ontario LHIN CEOs to share the vision of a true Ontario eConsult provincial program. And you can just see highlighted that base, so that model of the managed specialty groups will be the reference model for regionally focused services as they become ready. So this is what really launched the true provincial program. So the Ontario eConsult program includes 4 services. The new Ontario eConsult service, which I'm going to speak to, the Champlain-based service, which we've just talked about, that's on that through SharePoint and primarily serves the Champlain and Mississauga Halton LHINs. Teledermatology, which is on a separate platform, which many of you may use, that will continue as is. It is only, of course, for dermatology. And teleophthalmology, the retinal photos for diabetes screening, will continue as is. So here's the long list of provincial partners. So the Ontario eConsult Centre of Excellence is what Claire and I are leading. It's housed at the Ottawa Hospital in partnership with the Briere Research Institute. And our job really is to provide the clinical leadership and program oversight to enable the spread and scale of eConsult. We're responsible for recruiting and onboarding the specialists, but really it's about leading the program and spreading and scaling so that all Ontarians have access Telemedicine Network is the primary technology service provider. Ontario MD is leading the EMR integration and involved in the adoption and change management as well. So as I mentioned, a new platform went live at the end of June 2018, and it is on the OTN platform through the OTN Hub, so that if you have access to other services, such as the video conferencing through the OTN Hub, the eConsult is part of that same entry point. When you go, you'll sign on to the OTN Hub and request an eConsult, and then you will be taken to a page that will ask you whether you want to consult a specialty group or an individual specialist. So if you have someone that you really want to ask your question to, you can see whether they provide eConsults and can direct it to them. If you don't, if you're not sure, then you can use the managed specialty group so that you can be sure that your question will be answered by a specialist in that specialty group. So if you ask for a specific provider, you type in and it will search. So CARD for cardiology. If you were looking for a cardiologist, it will also pick up Dr. Cardinal, for instance. But you will see all of the people who are available for cardiology. If you knew the name, you would type in the name, and if that person provided eConsults, their name would appear. If you decide that you're going to go through the managed specialty group, you're going to pick the specialty. Here it's gynecology, and then you're going to select the subspecialty. So we have a provincial gynecology service. We have gynecologists in Brockville and Kingston as part of a regional service for the Southeast LHIN. We have gyne-oncology, so a subspecialty of gynecology, urogynecology available provincially. So there are different subspecialties listed in that second drop-down menu. These are the current specialty groups through the provincial service. So when we went live at the end of June, we were really hoping to get our top 30 or so specialty groups populated, ready for everybody in Ontario, and we exceeded that tremendously. So really, all of the major specialty groups are here for you to refer to, including a long list of pediatric subspecialists. And many of these groups, as shown with the gynecology, will have subspecialties linked to that larger group. But we were very, very happy to be able to populate the provincial service with such a broad menu of specialties. So this is the page that you actually come to. So what do you need to do once you've chosen, here it's endocrinology provincial group? You're going to put in the patient's name, their date of birth and gender, and if they have an OHIP number, you will enter it. For your homeless population, if they do not have a OHIP number or they do not have it available to you, you can click OHIP number not available. Then in the request, you're going to type in what your question is and what the background is for this patient, or you can see with the paperclip, you can actually drag and drop a file. So you can create a referral like you would do for a face-to-face visit, save it, and then drop it into to here. So you don't have to re-enter it if you have a way through your EMR for creating a referral and simply attaching it as a document. Same with a photo or a lab result, you're going to attach those as documents. So with the eConsult programs, so this is the last 12 months in Ontario, 40,000 people have received an eConsult, and there are 3,645 active primary care providers participating. That includes nurse practitioners as well as family physicians. We're currently processing about 4,000 eConsults per month, which continues to grow month over month. What does the province want us to achieve? So last year our fiscal goal was to achieve 30,000, which we exceeded. This year they would like us to achieve 50,000, which we're confident we will reach. You'll see for fiscal year 21-22, the goal is 140,000 people in Ontario will have an eConsult sent on their behalf. So that's 10 per 1,000 people, and that's less than what we do in Champlain right now. So we're sitting at 11 to 12 eConsults per 1,000 people. So with a mature service, with the engagement of primary care and the menu of specialists that we now have available, the goal is to get the rest of the province up to the same utilization that our region has been able to achieve through the many years of it being available. So will it be hard to get that uptake? Yes, but is it doable? Absolutely. So you may be thinking this looks great, but I use an EMR, and I shudder at the thought of having to manually enter 3 fields. There are 2 ways of integrating it into your EMR. One is full integration, so that it's all built directly into your EMR, and the other is using a delegate or a workflow. So full integration is being led by Ontario MD, and they are integrating eConsult into 2 provincial EMRs, Acuro and Oscar. And that proof of concept will be done by March 2019. So they are, with the new build of the new platform, they needed to change specifications, which they're working on. What that means is that at the end of that, they will be able to tell all EMR vendors, if you want to integrate eConsult directly into the EMR, this is what it takes. These are the specifications and the builds that it will require. Unfortunately, the EMR vendor then will make a choice whether they will fully integrate eConsult into the EMR or not, and how that cost is given, downloaded to providers. So still a bit of a black box what will happen after March 2019. The province and Ontario MD are working very hard to come up with a business plan that makes sense, that will incentivize EMR vendors to do that, but it's still unknown. So the other way is using a delegate. So it depends in your workplace setting how you manage your usual referral. So think about how you would send a referral if it was a face-to-face request. Do you send it in, or do you have someone who helps you do that? Using a delegate allows you to do it within your EMR, and then someone else goes into the eConsult platform and attaches it and sends it on your behalf. And we've used it both in the Champlain base service, but also on the OTN platform, and it really does work well. So what does the delegate do? They, as I mentioned, go into the eConsult system on your behalf. They retrieve the eConsult request from the EMR. They send it to the system. They get notified when the specialist responds, which they will then notify you, and they can access the response and attach it to the EMR for you. So because you do need to incorporate it into the patient record. They can also help as far as the survey questions at the end and closing the case. So this is just the workflow. So the primary care provider, you do it like you would your usual referral into your EMR template, sent to a referral clerk or administrative assistant, and then they're going to upload that for the specialist to answer. The reply to the referral clerk, back to you, and then it's closed off. And really what happens is the delegate logs into the service, and they have your name as a provider, a requester, that they're able to submit the eConsult on behalf. They choose your name and submit the case. So really, that's a very quick, brief overview of the current provincial eConsult program. There are the 2 services depending on where you practice. So if you are in the Champlain or Mississauga-Halton region, the Champlain base service and platform. If you are in any other part of the province, then the service available to you is through the OTN hub, really mirroring each other, very similar availability from a specialty service point of view. And I'll just leave it there and maybe open up for questions. Any questions or comments?
Hi, Mary. This is Lois. I'm wondering if you can read some of the questions that have been coming in through the chat room.
Yeah,
Definitely, I can do that. So the first question we received was, are family MDs also using this service as much?
Yes, they are. It depends. It's very interesting region by region, but yes, there are some regions where there is very high uptick. In Champlain, we have about 70% of our primary care providers registered, about 30 to 40% of our active users. In some region, the number is very low, but we absolutely are actively engaging and recruiting and encouraging primary care physicians to use it.
Erin, it's Andrea. Can you speak to, do you know the statistics between nurse practitioners versus family physicians in terms of their utilization?
I don't, as far as number of cases per, no, I don't have that number off the top of my head. There is a slight difference in which specialties people use, and I think that speaks to the patient demographics. But I don't know of a number from a utilization point of view or number of cases per provider. I'd be really interested from the folks in the, unless, are there other questions, Mary?
There was just one other that came, so I was just going to read that out. The question was, can I access eConsult without having an EMR?
Yes.
I'm still using paper charting.
Absolutely. So EMR integration is a nice to have, not a need to have. So it's a web-based service, so all you need is access to the internet to be able to use the service. But absolutely, once you get your reply, you would simply print the PDF of the encounter so that you can incorporate it into the patient chart. As the primary care provider, you're responsible for either acting or not acting on the advice, and you're responsible for keeping a record in the patient's chart, however your patient chart is, but you can absolutely print it and save it into a paper chart. Any other questions or?
It's Kelly Lumley-Leger. I just wanted to thank you very much for the presentation. And in your numbers, it looks like there are a number of NPs in the province currently using eConsult, which is fabulous. But I'm sure there's people who would have loved to have participated tonight, but for whatever reason weren't able to. Is it possible for us to post a link to the presentation or send out a link to the presentation to those who weren't able to participate, and they can access with general questions or kind of the next step slides that you have if they've got further questions?
Absolutely, and I'm happy for any to individually reach out as well. But yes, we could. We'll send you a copy of the slide. Where would it be best to? How would we best facilitate that?
Whether it's a copy of the slides or a copy of a link to the recording of it, I'm not sure which is best or which is possible, but either one of those would do, and we can make sure, whether Cheryl, I don't know if it can be put on the NPAO website, and we could certainly send it out to our contacts again who I'm sure would have loved to participate this evening, just to broadly distribute the information, and they know how they can get a hold of you for further information and registration.
Yeah, absolutely, Mary, and Andrew, I'll leave that to you to figure out the best way.
Yes, I was just going to chime in. This is Mary. We're planning to post a link to the recording, so we'll be sharing that with you, Kelly.
Perfect, thank you.
And then, the other, we're happy to repeat, so if there is another opportunity or another time that you think happy to repeat session at another date or another. If there are other meetings that nurse practitioners tend to come to, happy to present there as well. So open to whatever we can do to get the message out.
Super, thank you.
This is Cheryl. The biggest request was how do we get onto it? That's from about 20 NPs. I have provided links to most of them that I could find. Like most of the people, I tried to get back with them. They'd also like the link to the slideshow and recording. So that was the other thing, because some of them couldn't attend. And the ones that have signed up, they were interested in just seeing what the material was about, but they needed to do it on a different time. But thank you very much for the presentation.
Oh, you're welcome. And like I say, feel free to have them contact us directly, and we will get the presentation posted though as well. And like I say, if other opportunities or requests for hearing about it, happy to try and accommodate that. So we really value having nurse practitioners on the service. I think it provides a great primary care for patients that we would love you to be able to use it for your patients. And please reach out